Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight we have a doctor from Glen Cove Hospital to help you sort through what's going on with COVID-19 in our communities and across the regions. And of course, every night we want to hear from you. This is a call-in show, so call us at the number at the bottom of your screen, 516-393-1800. Well, truly disturbing. That's how Governor Cuomo described the mysterious illness appearing in children believed to be connected to COVID-19. Well, today the governor said 14 states are now investigating this inflammatory syndrome and urged parents be aware of this. New York has now identified more than 100 cases of what's now being called pediatric multi-system inflammatory syndrome, or PIMS. Now, Cuomo says the children are predominantly between the ages of 5 and 14 are being seen in all races. New York State now reaching more than 340,000 positive. That's just general coronavirus cases. Long Island, we account for almost 76,000 of those cases. 76,000. Let that sink in for a second. As for reaching the state's 7 metrics for reopening, Nassau still falling short in the testing area. Today, County Executive Curran urged residents in Nassau's hard-hit minority communities to get tested. Governor Cuomo says overall, though, deaths, hospitalizations, and intubations, those are down. And Suffolk Executive Steve Bellone says today is the first day in that county that it's seen a decline in new hospitalizations. He says that's one of the key benchmarks needed for reopening. New York's death toll, though, look at this, surpassed 22,000. Those are the deaths. Almost 3,700 of those right here on Long Island, both our counties. All right, let's get to our discussion. Joining us tonight is Dr. Barbara Keber. She's the Chair of Family Medicine at Glen Cove Hospital and the Vice Chair of Family Medicine for Northwell Health. Thank you so much for joining us tonight, and thank you for everything you're doing on a daily basis and keeping us safe and working these tireless hours and then coming and talking to us at night. So thank you for all of that. How are you holding up, and how are your colleagues holding up?
Well, you know, it's been a long haul, but you know, we're holding up pretty well. Things have started to settle down just a little bit now in the hospital setting, but now we're picking up in the ambulatory setting, which has always remained relatively busy. But thank you for having me this evening. Okay,
and plenty of PPE and everything. I mean, we had Dr. Sood on last night. She also works at Glen Cove. Said that Northwell is very fortunate in that area.
We really are, and I think that's one of the advantages of being part of a large system. You know, we share with our sister hospitals. So one place doesn't have something, we can get it from another one of our facilities. So, and relatively quickly. So we've really not had any PPE shortage issues within Northwell.
Okay, let's get to some of the questions right now. I think we have John from Deer Park on the line. John, are you there?
Yes, I am.
What's your question tonight?
Yes, doctor. I just had a question. If and when we get back to any semblance of normalcy, do you think it would be a good idea? You probably remember the old days when we did the gas rationing. As we go back to the stores, let's say the supermarkets, big box stores, Target, Walmart, of that nature, to break the alphabet up into 3 or 4 categories and have people go on the day that their last name or the letter of the last name starts, and maybe close the stores for a day or two for cleaning, disinfecting, and restocking.
All right,
that's a terrific question. I'm not sure that I really am the one that has the answer to that. I think that, you know, there are a variety of ways of doing things. I think that a lot of what the stores have done at this point is to, you know, have hours for, you know, people who are, you know, older and at higher risk, and have those as separate hours. I think that's a great idea that they came up with. And then putting social distancing and arrows in the store so that you can kind of follow along. I think it might be difficult, you know, if people run out of things unexpectedly. I think to say you can't come to the grocery store for 3 more days might be a little tough.
Yeah, and I think I can see people cheating all over the place in this. Using your maiden name, using your hyphenated name.
Yeah, I don't know.
Interesting idea. It's a really interesting idea, though. Let's go to Christine. Are you there?
Yes, I am.
What's your question tonight?
I just want to know, of all the COVID-19 deaths on Long Island, what is like the age breakdown? Is it mainly an elderly population that we've seen?
So, unfortunately, not really. And I can say that from personal experience, you know, patients that we've had here at Glen Cove. There is a wide age range, and yes, initially there was very few reported deaths or illness in children. However, with the new pediatric inflammatory multi-system syndrome, coming about. We're starting to see some deaths in younger children, again, generally from the ages of 5 and up, with that particular entity. And again, we think it's related to COVID, but because people are testing positive or have the antibody, we're not 100% sure exactly the mechanism for that at this point. It's still pretty brand new as an entity. I think that the oldest person I've seen is someone who was 96, but I'm pretty sure that there are plenty of individuals in their 80s and 90s who have passed away from COVID. However, we've also seen people in their 30s and 40s, some of whom, and I'm sure you've seen some of the stories on the news, some of whom don't necessarily even have significant underlying conditions. So I think that's one of the things. If you have underlying conditions, yes, that makes you at higher risk. And if you're elderly, it makes you at higher risk. But it doesn't preclude other age ranges from getting the disease and actually having serious course and passing away from COVID-19.
Yeah, that's tough. Let's go to Carmen. Are you there?
Yes, I am.
What's your question tonight?
My question is, can the kids get Kawasaki even though they already had the virus?
Okay, so that's a terrific question. Kawasaki's disease is usually something that comes after some type of viral illness. So we think that this is a similar kind of pattern to that. It also has a lot of the similar symptoms with the abdominal pain, nausea, vomiting, diarrhea, rash, high fever. And I think that the real thing is that it comes after the disease. So some children may have had either an asymptomatic case or a very mild case, maybe with just a little sore throat or a little bit of a cough, and actually have had COVID and then progress into this syndrome secondarily. And it's very difficult to know which children it would affect. There's really very little known about it at this point. So Kawasaki generally follows a viral illness, and this seems to be doing that same kind of thing, which I think is part of the reason we have only just recently identified the syndrome.
Now, Doctor, you're not just the chair at Glen Cove for Family Medicine, but you're the vice chair for Northwell Health. Are you this may be a premature question because we've only been around a few months with this virus, but why are we just seeing this PIMS now, or why are we just hearing about it now and weren't hearing about it so much in February? Is it because the population that is being tested is much larger?
Exactly. That's exactly right, Stone. I think one of the things that we're seeing is we're looking more closely at what's going on in people who've been tested. So if you're testing people, particularly now that we have antibody testing for people who may have had the illness, and so if family members have had it, some of the kids are being tested, and then if they become ill, clearly, we're connecting it. Again, it's because it dates after, or its onset post-dates the viral illness itself. So it may come several weeks to months after a viral illness. It's still connected to the illness, but again, we're not sure of the exact cause or the exact mechanism at this point because it is just brand new. I mean, this has really only been, we do have over 100 cases in New York, as you mentioned earlier, but again, we only just started to see this and recognize it as that fact that it may be related to COVID because they just started doing so much more testing.
All right. Let's go to Norris from Smithtown. Norris, you there?
Yes.
Thanks for calling. What's your question?
Doctor, thank you and all your other frontline workers for your service. My question is, why is the USA not spraying the streets and public places for the virus like I see a lot of other countries doing?
So I think there's no good, a lot of things that we try to do, particularly amongst the scientific community, we try very hard to do things based on evidence. I don't think that I've read anything, and I've been reading like crazy on everything I can get my hands on about COVID-19, and I have not really read anything that provides good evidence that doing that, it's wonderful to clean things, and it's certainly something that can be gotten rid of with even just plain good soap and water cleaning. But there's not great evidence that it sits around on the streets or, so I don't know about spraying the streets. That may not really be that effective. We do know that it does, that the virus does have a propensity for things like stainless steel, for instance. So I know that we're in our facilities and whatnot, we're particularly having our environmental services workers actually cleaning doorknobs and things that are made of stainless steel, and that's the reason to really wash hands frequently with good warm soap and water. If you don't have that available, to use a hand sanitizer, particularly after you're touching things that that the virus might be harbored on, like stainless steel doorknobs or other things like that. The street, probably not such a big place to harbor the virus.
Okay, we're going to take a real quick break, and when we come back, we're going to have much more expert advice on how to keep you and your family safe from the coronavirus. Remember, we want to hear from you. This is a call-in show, so call us. The number is right there on your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Barbara Keber, the Chair of Family Medicine at Glen Cove Hospital and the Vice Chair of Family Medicine for Northwell Health. Doctor, let me ask you this. Because you said earlier that the hospitals, they're starting to free themselves up a little bit. The capacity is going down a little bit more. What's your advice to people who are at home, maybe feeling ill, but are afraid to come to the hospital?
Right. I think that's a very important point to make. The problem that we've seen, and we've seen it several times just at Glen Cove, but people are waiting very much longer than they normally would because they're afraid to come to the hospital. They're afraid to come to the doctor's office. So Dr. Sood talked last night about, not being afraid to come to the emergency room. I think the same thing is true. Please, if you're having a particular issue that needs attention, please call your doctor. Most people have a primary care doctor or specialist that they use on an ongoing basis. If you're not feeling well, that's your first go-to person, particularly your family doctor. And I think that that's a good way to get some advice about what to do or where to go from there. The other thing, though, is that we're starting now to be way behind. Children are not getting vaccinated. Adults are not getting their vaccines in timely fashion. Some of the screening things that we do for, say, colon or breast cancer that are really important for people going forward are getting left behind and are not being done. There are a lot of ways to do those things without necessarily coming to a doctor's office or there's a way of coming, and the doctor's offices are really very safe. We have PPE in the physician's offices. We've done a lot of retooling in the ambulatory practices around making sure that people are escorted right in. They're not waiting with other people in the waiting room area. Okay. So we're separating people out. So,
all right.
So I think it's very safe.
Okay, great, fantastic. Let's go back to the phones. Ginger, you there?
Yes, I'm here.
And what's your question?
I just wanted to thank the doctor for her time and service. My question is, our neighbor's tenants were tested positive for the virus 3 weeks ago. My neighbor who lives downstairs, who does our shopping, she was tested at that time. She was negative for the virus and the antibody, but she does my shopping for me and my mother because we're high risk. Today she tested positive for the virus. What would you recommend? We be tested or wait for signs and symptoms?
So I think you can go either way on that, and I think the question is, sometimes if you have something, you might be a little bit more quick to jump on some symptoms if you've been tested. Now there's still some testing centers which are only testing patients who are complaining of symptoms. So my best advice to you is call your regular physician. If you're high risk, then I'm sure you have a physician that you see regularly or routinely. I would call that physician's office and see if you can get some specific advice for your particular situation. But generally, the thing is, you would want to probably get tested if you've been exposed to that person, and this is somebody who does your shopping, etc. So have you had other exposure besides just having them just hand groceries into you, or?
I think we lost her. So
yeah. So I mean, that's the thing. It's really about exposure directly to the person who's been tested positive. That's when you should be tested.
Okay, let's try to get Anna in. Anna, you there?
Yes, I am. Thank you, doctor. We have an awesome 11-year-old who has Down syndrome. He also has celiac disease, neutropenia, and hypothyroidism. My question is, are you seeing the new cases of PIMS in children with special needs, such as our son? And what do you recommend moving forward as far as extra precautions?
So as far as, let me address the last part of the question first. The extra precautions, absolutely. I would really try to keep him relatively isolated from other individuals, and anybody who's coming in or out of your house really should just be the immediate family who lives there. I wouldn't have any exposure to other outside individuals. Again, good hand washing, cleaning of surfaces, like we mentioned earlier. And I think those are the main precautions to take with him. As far as whether or not we're seeing PIMS in this particular subpopulation of kids, again, any high-risk child is at risk to develop PIMS without question. Are we seeing more of it? I think, there was a little boy released from Cohen's Children's yesterday. He's a perfectly healthy child with no actual medical problems. So it can certainly affect any child, and I think that's the word to the general public. It really could affect any child, regardless of whether or not they have extra risk factors. But clearly, your son would be at probably a higher risk to certainly contract coronavirus. But whether or not that would then produce the PIMS is not. It's really still to be studied.
Okay. Unfortunately, that's all the time we have. Dr. Keber, we thank you so much for everything you do on a daily basis and for coming onto the show tonight and giving us this public service. Thank you very much for that. And to thank you, all the viewers, for watching us every night and for your calls. We'll see you tomorrow night at 7. Stay safe. I'm Stone Grissom.